Hi friends, Grace Rosa here. I hope you're having a wonderful week. We are now at the midway point, halfway to the weekend. And today I'm talking about your brand, your personal brand or your business brand, or maybe both. So people ask me often, should my name be my business name? And as you may know, I do help dentists with their marketing. That's primarily what I do. And I, on a daily basis, talk to probably 5 dental professionals outside of my own business. And we talk through growth plan. We talk through a growth plan and we put together that plan. And so oftentimes I'm asking questions such as, tell me about your business. Tell me about how many new patients you're seeing. How many would you like to be seeing on a monthly basis? And then from there, I often ask, well, how do you want to be known? And describe your ideal new patient to me. And tell me about some of your favorite dental procedures that you like to provide. And tell me about the ones you prefer to hand off to somebody else. And these questions allow me to get a big picture view of the business, where you are and where you're going. And in these questions, I also have the ability to look at, does your branding, so the materials that represent you, like your name, your tagline, your logo, do those things represent the things that you just told me? And I don't force people to change their brand. I think it's important to know that if you're already established, if you're already growing in your community, people already recognize your logo and your colors and your name, it may not make sense for you to rebrand right now, but I do like to give that insight. This is a field of study. And as someone with an advertising degree with a minor in psychology, I spent a great deal of time, not only in my formal education, but also in my professional career, understanding the psychology of marketing, evaluating how different brands are perceived and why they're perceived the way that they're perceived. And so when I look at a brand, I know instantly what kind of emotion is this brand deriving from the audience, based on colors, based on fonts, based on symbols, and based on current trends. So I look at all these things and I'm able to say, this is the impression that your current branding, which also includes your website, is making. This is what your marketing is saying about you. Does that match who you are? Does that match how you want to be perceived in the community? And if we have a disconnect there's opportunity to make an update. So keep that in mind when you have this conversation with me. Also, and this is the meat of what I want to talk about. Your business it's not always appropriate to have your business named after yourself. Some of the questions I ask in order to help people to make this decision are the following. 1, do you plan on selling your business in the next 5 to 10 years? I can tell you right now, if a buyer came in to purchase my business, and I'm not looking to sell it, I'm just using an example, and they were looking at the value of my company, and I wanted to sell, and I didn't really want to work in the business after I sold it, that's going to be a more challenging transition for a buyer to be successful with that business when it's named in my name. People are going to expect to see me. So even in most states, you can keep the business name consistent for up to a year. If it is the doctor's name, it makes for a little bit bumpier of a transition, and it may also make for a less desirable practice in terms of or business in terms of a purchasing agreement. So think about that. You also want to think about how do I want to expand, or do I want to expand? Do I plan to eventually have associates? Now let's talk about instances where it does make sense for the name to be in your name. Let's say you are a solo practitioner. You plan to practice for another 15 to 20 years or several years. The business is in your name. You're not looking to sell it. You are the main provider. You're not looking to bring in any associate doctors. And the biggest selling point in your business is your clinical expertise. And you want people to value your amazingly meticulous veneers, then at that level, it may make sense for your name to be the business name because you are the center of that brand. As I always say, the right way to brand, it depends on your situation. There's no hard and fast, if this is the situation, this is how you should do it. You also have to consider where you're at right now, if your name has brand recognition, and this is the way you've always done it. you may need to keep it that way, or you could see an immediate drop off in your business. So just like really great dentists will treat every patient individually and create an individual plan, a really great marketing advisor will do the same for you and consider the big picture and where you're heading before they give you a hard and fast, this is how you do it. So I hope this information helped you. And if you need any help either evaluating your brand, building a brand, launching a new business, I would love to have a conversation with you. Thank you guys, and have an awesome day.